Hi, I'm Dr. Mike Milligan. We're here at the Chicago Midwinter Meeting, so there's a little background noise there. But I'm here with Dr. Lorin Berland out of Dallas, and we're going to talk about a number of things. First thing we're going to talk about is one-day inlay onlays. Great topic, something we're all interested in. Lorin, go ahead and tell us about that. Nice to have you with us here.
Nice to be here, Mike.
Thank you.
Well, this is something that I've been doing for over 20 years. I was always looking for ways to restore teeth conservatively without, losing any tooth structure, less sensitivity, making it look good, making it last a long time, and being done in the least amount of time.
Okay,
so
that all sounds great.
It all sounds great. And we've all been there replacing giant silver fillings, and sometimes when a tooth is prepped for a silver filling, it's not always ideal for a direct composite filling.
Right.
We're all taught that silver fillings have to be so deep, so wide, extension for prevention, undercut so they don't fall out. Well, that's not the way you would prepare a tooth for a successful direct bonded restoration.
Right.
So if you've got problems with discolored fillings, with failing fillings, a lot of people go towards crowns. And crowns are durable, but you lose a lot of tooth structure. And, I know myself, I'm always trying to hold on to as much as I got for as long as I got.
Absolutely.
So I don't like to hasten the destruction of body parts or amputation of body parts. So I started doing a lot of inlays and onlays rather than crowns.
Right.
Or, cusp fractures, stuff like that. And I've been doing it for some time, and I've developed a technique that for the last, at least 10 years, we do it all the time.
Great.
And
patients are accepting
patients
of it?
love it,
Yeah.
especially the patients who've had crowns in the past.
Yeah, you just educate them on the value of this, and then they move right ahead. And
and it's especially the last 2 years when dentistry suffered a little bit of a recession, a little bit of a decline in elective dentistry.
Yes.
This part of my practice did not decline at all.
Wow.
Because, for a lot of people, this kind of dentistry, especially if they're concerned about amalgams, and that's just going up and up and up,
yes.
Especially with the internet. Recently there was a big news about mercury somewhere, I forgot what. But anyway, it's going up and up.
Sure.
And, a lot of people do not consider replacing their silver fillings as elective dentistry. They consider it preventive.
Yes,
as
I've seen
health
more of
maintenance.
that in my own practice, right?
Right, and so that part of my practice I didn't see any decline. Whereas, let's say my high-end cosmetic procedures might have.
Right.
So, this has been a terrific thing. Okay. So
now, where do we find this book or more information about this for you?
You have
a website?
I have a website. It's BerlandDentalArts.com.
BerlandDentalArts.com.
Yes.
Berland being B-E-R-L-I-N.
No, B-E-R-L-A-N-D.
L-A-N-D, excuse me.
It's okay. L-A-N-D.
DentalArts.com. Okay.
And if you go to the site and go to Professionals Only, I did a CD that has recently been awarded 8 AGD credits.
Okay.
And I think that
8 AGD
credits for the CD.
Okay.
And I think that dentists who want an introduction and how to, replace these fillings or do quadrant dentistry, another thing is this is much better than like the CEREC systems or the E4Ds, because with those systems you can only make one restoration at a time. With my indirect restorations, you can do a whole quadrant at the same time.
Right.
So it's a tremendous time saver. In fact, if you want to save time, save money, save your patient's tooth, this is just a great technique.
It's a wonderful technique. Now, the other thing is, you were mentioning to me, this is 8-hour CE credits, but you don't take 8 hours to learn this. The CD is about how long to learn this?
It's about 400 PowerPoints.
Okay, and about how long is the dentist going to be spending to learn this whole technique?
Well, you know, you could probably go through the whole thing in a couple of hours.
A couple of hours, okay.
But, you know, you got to think about it afterwards. And I think it'll make you think. And I think it's something you'd want to share with your team, because it also talks a lot about, you know, addressing your patient's concern about this kind of dentistry.
Fabulous.
But the demand is growing like crazy.
One of the concerns.
There's gold in them silver fillings.
Right, great. I think one of the concerns that dentists would have is, how do I tell my patients, you know, that the insurance might not cover this, but that it's of value, and that's addressed in your CD as well.
Yes.
That's so important. That's great. That's great. Lorin, thanks so much.
Thank you so much.
It. Great.
Thank you.
Alrighty.